we get started, if all community board chairs, elected officials, and reps can take a seat around the table.
So I have a motion by Anthony, seconded by Roberta for adoption of the meeting agenda. Everyone in favor, say aye.
Aye.
Anyone against? Any amendments? Okay, the ayes have it. Do I hear a motion for the adoption of the Borough Board minutes from July 18th and 23rd? Okay. All in favor?
Aye.
Thank you, the ayes have it. Is Neisner here?
Yes, yes. you're right here.
Neisner's in the house. Well, we are
up to the front to do the presentation.
Judith Cutchin and Robin Krinsky from New York State Nurses Association. And as you heard it, Neisner is in the house, so we're ceding the floor to Neisner. And before we get started, I just want to welcome Barry Weinberg to his first Borough Board meeting as chair of CB9.
Good morning, everyone.
Good morning.
My name is Julia Kamagong, and I'm staff of the New York State Nurses Association. And we want to thank you for giving us the opportunity to present on the safe staffing legislation and our request for you to pass a resolution in support of the safe staffing legislation. We have two nurses to present. I'm going to call on Judith Cutchin to first speak, and then Robin Krinsky. Thank you. I will be passing around the materials too. Go ahead.
Good morning. Thank you for allowing me to be here. My name is Judith Cutchin. I am the president of the Executive Council of the New York State Nurses Association Public Sector and Mayorals. I'm also on the board of directors. I'm also an active nurse at Woodhull Hospital. That's in Brooklyn, New York. I've been there for almost 28 years. 29 years of my career. I've been there for 28. And the purpose of the presentation is to request the Manhattan Borough Board to pass a resolution in support of this enactment of the Safe Staffing for Quality Care Act. All too many times we have patients that come into the facilities, especially into the ICUs, in the emergency room, the operating room, and there's not enough staff. These patients are discharged to home, they're not ready, and they end up coming back to the hospital. A lot of times also in the psychiatric department, the patients are discharged prematurely and they go out and they have a relapse. They're readmitted to the hospital without proper care, proper treatment, and education because there's not enough staff, there's not enough safe staffing to support the patients that we have. And the reason why we want to pass safe staffing legislation for New York State, safe staffing is a cost-effective way to improve patient care and to lead to saving hospitals and our healthcare system. In California, hospital income rose dramatically after safe staffing levels were implemented. $12.5 billion from 1994 to 2003, and $20.6 billion from 2004 to 2010. Safe staffing, it reduces turnovers in hospitals. We have nurses coming in. If it's too short, they go out. So we have a rapid turnover rate, which makes that an unsafe environment. Inadequate staffing levels are correlated with poor patient satisfaction, poor patient care. More revenue for hospitals and nursing homes due to increased positive patient outcomes is very cost-effective way to improve the patient care. The impact on safe staffing on health and public hospital system. On June 24th, at the New York City Council, they conducted a hearing on the same resolution. Our CEO and president of H&H, Dr. Mitchell Katz, he also testified on why safe staffing would make sense. It would make dollar sense also. He mentioned that he's in support of safe staffing as he was the director, sorry. He was the director in Los Angeles County in the health agency where safe staffing levels were implemented and patient outcomes improved again. The recruitment and retention rose, and that was across the board for all staff, not just RNs. It was patient care associates and across the board. It is true that we will need more funding to implement safe staffing ratios. We know that we will need funding for that, but just think about how it would affect if we didn't have the funding. You're gonna lose money anyway, because the patients are gonna be readmitted, and you don't get paid, CMS will not pay for that. The issue is more allocation of decision of where we prioritize to allocate money and not about the funding, because we always fight to get more funding. And we wanna ask ourselves, what is the level of care that we deserve, that our family members deserve, that all New Yorkers deserve? It is time that we're looking to set the priorities straight, and the priority is the patient first. Thank you. We're asking you please pass and support the Safe Staffing for Quality Healthcare Act in Albany. Thank you so much for having me.
Good morning, my name is Robin Krinsky, and I work in the cardiology department at the Mount Sinai Hospital on the east side. I've been a nurse for over 30 years. I won't tell you how much over 30. And I've been at the Mount Sinai Hospital for about 22 years in various roles. I live in Community Board 7, I work in Community Board 11, and I'm also faculty at Lehman College and Beth Israel School of Nursing, and a member of PSC and the UFT. I'm the president of my local bargaining unit at Mount Sinai, which has over 3,200 nurses, members in my bargaining unit, nurse practitioners, midwives, and nurse anesthetists. I'm also the director at large on the board of directors of NISNA. I wanted to thank you very much for giving me this opportunity to present to you today. The purpose of my presentation is to request Manhattan Borough Board to pass a resolution in support of the state enactment of Safe Staffing for Quality Care Act. This past spring, we had 6 months of very torturous negotiations with the Alliance hospitals, 3 major hospitals being Mount Sinai, which is also St. Luke's, and now Mount Sinai West, New York Presbyterian, and Montefiore. We finally ratified a 4-year collective bargaining agreement, and these Alliance hospitals, as you know, are the major employers in New York City and in New York State. We have, as nurses, have made significant strides based on these contracts at these major hospitals. The frontline nurses, the people who care for you, your families, your children, your neighbors, nurse practitioners, nurse anesthetists, and case managers will now have an effective input in establishing nurse-to-patient grids or nurse-to-patient ratios that will ensure our #1 priority as nurses, which is safe staffing. Most importantly, for the first time ever, we now have a transparent enforcement mechanisms that hold all parties accountable in achieving this goal. The combination of staffing grids or ratios, enforceability with transparency is really the winning trifecta for both our patients of New York and our nurses. We are in the process of now looking at every single floor, every single unit and service, and allocating nurses to the areas that need them most in order to provide safe patient care and quality patient care. These allocation committees are composed of frontline nurses. I have nurses coming from all of my units to speak to management about the need for better staffing. We work with nursing management, we work with labor relations and human resources as a team to ensure only the highest level of care will be provided for all New Yorkers, from the neonatal intensive care, our smallest patients, to palliative care. We care from people from the cradle to the grave. So why do we need to pass safe staffing legislation for New York State? Safe staffing ratios improve patient outcomes. There is evidence, tremendous amount of evidence that reflects that. Safe staffing saves lives. The number of patients assigned to a nurse and caregiver has a direct impact on the ability to appropriately assess, monitor, and care, and safely discharge our patients so they don't get readmitted. Outcomes are better for patients when staffing levels meet those established in California. Research has demonstrated that we save money, care is improved, length of stay is shorter for patients when we hit the California benchmarks. Hospitals that routinely staff with 1 to 8 nurse-to-patient ratios experience 5 additional deaths per 1,000 patients than those who staff at a 1-to-4 ratio. Now, 5 patients may not sound like much to you, but when it's your parent, your sibling, or your child, it has a different meaning. The odds of a patient death increase 7% for each additional patient that a nurse must take at any given time. The other thing about safe staffing is it reduces adverse outcomes for patients, especially in nursing homes. When registered nurses' staffing is increased by only 5%, the number of adverse events like pressure ulcers and pressure injury, catheter-associated infections, bloodstream infections, hospital-acquired injuries like falls, they're reduced by over 15%. Hospitals with lower nurse and caregiver staffing levels have higher rates of things like pneumonia, shock, cardiac arrest, urinary tract infections, and bleeding. And that all leads to higher length of stay. It increases mortality and morbidity of our patients. In nursing homes, safe staffing standards have a positive impact on both the facility's processes and resident outcomes. For example, fewer facility deficiencies for poor quality, and it improves the functional status of our patients. There is a correlation between unsafe staffing and high nurse caregiver turnover, so the turnover of your staff. And we know that in nursing homes, unsafe staffing results in more frequent use of restraining people, infection, the use of psychoactive drugs to sedate people, and the increase of contractures, ulcers, and adverse outcomes. We want safe staffing for all unionized as well as the non-unionized hospitals. We represent New York State Nurses Association, but there are many, many hospitals that are not unionized. The bill covers not just hospitals. My time up? Nurses, direct care staff. And the main difference between this particular bill and the previous bill is that it's not just the direct care staff, but the indirect ancillary staff. Hospitals and nursing homes deserve to have proper staffing for their patients and provide the quality patient care that every New Yorker deserves. In your packet, you have an article from the Buffalo News on nursing homes and the SEIU supporting the safe staffing legislation. It was the unity and determination of frontline nurses who fought hard to improve conditions for nurses and additional staffing for patients. The commitment to our patients was the driving force behind our recent contract. To sum up, safe staffing can be a matter of life and death, and achieving the right staffing levels requires nurses and management to work together as a team. Adding registered nurses to unit staffing has eliminated nearly 1/5 of all hospital patient deaths, reduced risk for adverse events such as infection and bleeding, reducing medical errors, and in particular because the Centers for Medicare and Medicaid have started denying payment for preventable hospital-acquired injuries or illnesses, and private insurers are following. Increasing the number of nurses in hospitals can yield cost savings of over $3 billion as a result of more than 4 million avoided extra hospital stays and extra hospital days. So what's the ask here? Well, it's really obvious. Please pass the resolution supporting the Safe Staffing for Quality Healthcare Act in Albany for the safety of every patient in the greatest city in the world and in the great state of New York. Thank you.
Anthony.
In the proposed legislation, is there a target ratio you're asking for?
Yes, in your packet, you will see some ratios, sample ratios of the different units, and so that is a proposal. But in the bill, it also talks about how we want to get a plan from each of the facilities, so that way they can make proposals on in terms of what their appropriate staffing would be.
Thank you.
Richard Lewis, Community Board 12. Everyone loves nurses, I think. My sister is a nurse, an RN. I just have a few questions. Is there any discussion on the number of beds because that's really what a hospital has in terms of rooms, as well as patients. So I'm concerned that there's no mention of that. And also I'm concerned that the longer you stay in certain hospitals, the likelihood of MRSA infections occur, and there's no mention of that kind of step in terms of those preventive steps in this measure. Finally, in my district, we have Allen Hospital, which is eliminating 30 beds for mental illness, which I believe your association had a statement on. And it seems to me that the loss of these beds, again, we open up another problem that this resolution doesn't really cover. So I'm surprised that that's not in it, since it's been a long-term battle for almost 2 years on this, 3 years on this whole thing with Allen Hospital.
Allen Pavilion.
And finally, there is a trend in hospitals today for hospitals to have, to go into housing for homeless, because there you have the early discharge, and then they're back again. So I'm concerned that there's no mention of that, and I know there was a major article in the March issue of JAMA that discussed this in detail and the success of that program in Chicago. So I'm concerned that this may need to be updated, and with all the issues that I just raised.
Well, the resolution that we're asking the Manhattan Borough Board to pass is actually, it goes actually beyond just the bill that is in Albany. And so I don't know if it might be a good idea to read it, but I also have a hard copy of the bills, which are in the Senate and Assemblies, and we can, definitely give you a copy of that.
I just think the wording should be more reference to the things I mentioned, and they're not specific enough, and so it is a concern.
Right. Well, this is a draft resolution that the New York City Council has heard, and it's a proposal. Of course, it's up to the Manhattan Borough Board to look at the verbiage of the actual resolution and add whatever else you think would be appropriate, and that everyone will agree to pass.
And I'd be happy to give you the JAMA article itself.
Yes, for sure.
Okay.
Alicia?
So I'm looking here at some proposed ratios that you have here. I think it's your staff, safe staffing fact sheet.
Yeah.
So I'm looking under psychiatric ed. Is that psychiatric ed in-house for children that are in-house in one of these type of schooling programs? Or is this, is the hospital? Which one is it?
Hospital.
It's the
Hospital-based.
hospital. Okay, so that number is a very low number. I think in order for observation in the crisis that we're dealing with here in the city of New York, it needs to be an increase, and I would suggest that you would say that you need more, because as we know, when a patient goes into a psychiatric hospital, it takes more than just one nurse to cover a patient if they're in crises. At the time of entry into a hospital, a patient may need about 3 nurses if they've been off their psychiatric meds for a long period of time. And also, I believe that when you're dealing with children with psychiatric conditions, one nurse can get overwhelmed with one particular child. It depends upon the condition of the child. So I just suggest that you would increase that number of nurses allotted for that placement.
That's a great suggestion, but with mental health, in the psychiatric facilities, not only do we have registered nurses, we have mental health workers on the unit, we have a lot of ancillary staff that care for those patients as well. So it's really the team, and especially children, like you said. We have an adolescent health unit in our facility, and we have mental health workers that are specifically trained to deal with that population. So that in addition to the nursing staff.
Just saying, as an instance, that there are sometimes patients that have medical situations where they don't want to take their medications, right? And so for one nurse, it can become overwhelming to try and get a patient to take their meds if they're refusing, right? So that's all I'm saying, is that there should be some type of increase, not just one nurse can cover that patient. You might need another nurse to cover it. 2 per one person, I believe, in the crisis that we're dealing with right now. If you're proposing something, let's be realistic about the proposal, okay? That's all I'm asking.
Thank you.
Great, yes, thank you.
Are you- This is referring to registered nurses as opposed to, what are they, practical nurses or?
Licensed
other-
LPNs, yes.
It's for registered nurses and all direct care staff. all staff who are touching the patients to take care of them. So not just registered nurses, nursing assistants, LPN, et cetera. And that's the big difference from the 2019 bill and the previous bills, because now it's more inclusive of everyone who's taking care of a patient, not just registered nurses.
Any other questions? So, I have a question. You mentioned that there are two bills. So you have one in the Senate and one
The
in.
same bill with two numbers. but it's the
Yes,
same
one for the
exact-
Senate and one for the
Right.
Assembly. And so, do you have bipartisan support on both of these bills, or?
We have a lot of sponsors for the assembly. It's already in the codes committee, I believe. But I need to double check on that, and it's still in the health committee in the Senate. So that's as far as it went as of June.
Barry?
You mentioned that Dr. Katz spoke in favor of these proposed regulations. Where do HHC's facilities stand now in terms of their staffing ratios?
So, we're in bargaining in H&H, so that is their acts and our acts at the same time, that we get these staffing grids based on the acuity of the patient, in some of the units, especially our ICUs and our ERs and stuff. So, he have experience from California where they have passed and they have maintained, the staffing levels, and so he speaks in favor of it. H&H is, we're working together as a team. We have committees that we formulate joint labor interdepartmental, so we can try to work together to fix these staffing ratios and staffing levels.
So they're not there yet, but they're on their way,
Right,
hopefully.
we're working on it. We did hire, H&H did, Health and Hospitals, they did hire a substantial amount of nurses. We have a recruitment and, a huge recruitment and retention committee now, so we can try to retain. This will keep increasing our staffing levels and maintain them at the same time.
Yes.
I'm just looking at this and I'm just looking at the last paragraph before you say staffing sheet, where it says resolved that the Manhattan Borough Board commits to pursuing the implementation of minimum safe staffing ratios and standards and and in all other acute care hospitals and nursing homes that receive funding from or contract to provide patient care services for the city of New York. What exactly is the expectation for the Borough Board to pursue? What is that vision that is there? Like that paragraph, can you explain that? Commits to pursuing the implementation of, what is that mean
It's more of
actually?
the, like the support and the enforcement to make sure that the H&H public hospital system is committed to making sure that if the safe staffing legislation is passed in Albany, that it will be implemented in all the hospitals in New York City.
Is that something that the Manhattan Borough Board can agree to do, Rosie? Is that something that, I mean, we can be in talks and stuff
I
like
mean,
that, but
we can advocate,
we can advocate.
right, and, you
Other
know,
than the
as a board, we
implementation
could pass a resolution, but we don't have any mechanism of oversight
Exactly.
as a borough board. So, you know, this would be something that, this is their proposed language, and then if the board wants to move forward with this, you know, the changes to this resolution can be made, to incorporate things that were said here today, and to change this
Yes.
to be more reflective of
Exactly.
what our ability as a board is. Yes, Councilmember.
Just want to say that I'm a sponsor of the City Council resolution, and who here's been in a hospital? Can I just see a so I think all of us at some point have had the unfortunate reality of having to been in a hospital, and what I'll say is I've been hospitalized, and I met my doctor for 30 seconds as I was going under, but never met them again. But the nurses are the folks who took care of me. And one of the unfortunate things I've seen is when the nurses are the front line of defense, I think you can tell the difference between safe staffing in an emergency room or other hospital setting, where when you press the button, the nurse is there, or they're actually able to proactively check on you. I've been in emergency rooms where they're just so overwhelmed, and there's 50 or 100 or more people there, and then the nurses are just so far outnumbered, and that affects outcomes, it affects quality of care. And I wish that hospitals were meeting demand instead of trying to pass the burden on to our nurses. But the fact that the nurses aren't negotiating for higher wages, but they're actually just saying, no, we want to have enough people there to do our jobs and be able to care for people, I think is a great thing. And I will say that the NICENA is here to try to push for this. There are other things that we can be pushing for and should be pushing for, and we can do that as elected officials to work beyond the resolution, I think. In terms of the implementation from H+H, I think the Borough Board could ask H+H to come after the passage of the Assembly and Senate bills, after they are signed into law, to ensure that they are doing, and similarly the City Council and the Hospitals Committee chaired by Carlena Rivera can also ensure, because what I will say is if all the laws on the books were enforced and followed properly by our government, I believe we might live in utopia, or the opposite, but I agree that we do need to do a lot of follow-ups. I just want to thank you for coming, and my daughter was born at Mount Sinai, so thank you personally.
Yes.
Maybe two related questions. What's the expectation in terms of when the bill might be passed at the state level?
Well, we'll be pushing very hard again come January, and we're hoping to get it passed, this next session. That's our expectation.
And the
We
related
have
que-
enough to pass the bill, enough supporters.
Oh, great.
Yeah.
Wonderful. And the related question is, was it our expectation that we would vote on this today, or?
No.
No.
Okay.
I mean,
Okay.
again, this is your borough board, so,
So
For some-
they've
for some
actually
boards-
drafted a resolution, because sometimes people will come and present, and then you go back and draft
Fine.
it. So we can talk about process,
yeah,
right?
it should probably go to your committees, whatever you feel comfortable with in terms
Sure.
of being able to authorize to
Yes.
cast a vote at borough board. So we don't suspect a vote coming before borough board on this issue, maybe probably realistically until October, while it has its way to make its way through different processes
Wonderful.
at each community board.
Roberta and then Molly.
Committee Board 7 has already passed a resolution supporting this, so, you may want to take it back to committee, board, and have them pass it.
If you could share those resolutions with Brian Lafferty, and we'll make sure
So
we get it out to
we
everybody.
passed at, was it June?
February 20.
February, but I think it was passed later, that, we passed a resolution in support of the safe staffing. And then it went before the Health and Human Services Committee, and then it went before the full board. So, I would just recommend that it's something that, each of the boards may want to take
So
up.
can you get us a
We can
copy
share
of that
Absolutely.
resume? We'll look for
Yeah.
it, and then we can get it out with these minutes in the next week.
I was just
Molly
going to comment
first.
that NISNA came to our November 2018 Health and Education Committee, and I think that at CD6, so we have a lot of hospitals, right? And I think the hospital ratios, NYU Langone in particular, were in compliance, or were very good. But they're pushing back hard. They don't want it to be mandated. So the committee, I think it kind of fell off. We didn't do a resolution, and I'd like to support this, and I know most of the committee wanted to support it, but they had some concerns and wanted to hear from the hospitals. So that, so I can bring this back to the committee, and they may, again, want to hear from Bellevue and Mount Sinai.
Councilmember Levine.
Well, I'm just such a strong supporter of this campaign. As you know, I consider it one of the top priorities for healthcare in the city and state. We had a really good hearing in June on this in the council. We've now got, I think, 33 co-sponsors at last count, so we're basically at 2/3 of the body. It should be coming up for a vote, I hope in September. Of course, non-binding, but definitely a great marker of political support in the body. The line from hospitals that we keep hearing is that they support this in principle, but they use the term flexibility. And really, it's not acceptable. they haven't shown willingness to invest in a world in which they do currently have the flexibility. And, you know, what we're asking for in safe staffing is not extreme. It is backed up by every piece of research that's been done about patient outcomes. I mean, that's what we know, that this is not just about keeping the patient happy, and it actually can impact their likelihood of survival, of having good health outcomes. Also, by the way, it affects burnout in nursing. Frontline nursing is about the toughest career out there. And, you know, the members that are at health and hospitals are all working for way less than they could in almost any other setting. And they're incredibly dedicated to the mission of health and hospitals. And they're just asking for enough people on the team to do the job right. And it's perfectly reasonable. So I do believe we need to push the state bills. We're doing what we can in the council. I think having a resolution out of the Borough Board would just add to the political momentum, and I'm really glad that you're here. And I know we're not voting today, but I certainly would support this body going on record in favor of this resolution.
Anthony, and then
I just have 2 quick questions. I gather the hospitals are in opposition. What about doctors' groups? Do you know?
So we have a few physician groups within our hospital. Of course, they're non-unionized, so they're employed by, you know, the hospital, and they're not as vocal, but they see the difference in staffing. They know we have a lot of chairmen who really are an advocate of ours, that know that better staffing leads to better outcomes for their patients, because they're the ones who get blamed for the infection and so forth. So they understand that when there's low staffing and when nurses are running around and not able to provide that level of staffing, that outcomes suffer. So our doctors are in support of us. But again, because they're not unionized, they're afraid to be more vocal.
And in addition to California, has this been passed in other states, and do you have any statistics about that?
We want to be the second state to have the safe staffing legislation, yeah.
And then the last thing is, could you just send your contact information to Rosie to distribute in case the committees would like a representative to come? Thank you.
Sure.
Anthony, you
I was
want
going
to
to
say
ask that, so thank you.
You're welcome.
Aldrin.
In terms of the language, and I mentioned it to you before, in terms of the language, both the resolution and what's before Albany, if you can make more explicit, because right now, in terms of nursing ratios, the staffing ratios is mostly like the patient experience with the nurses. And I know in the workforce development community, there's a lot of concern that this is gonna negatively impact nursing assistants, patient care technicians, and other ancillary supports. And at least in the resolution you presented before us, there's no real explicit mention of the ancillary supports and the other workforce occupations that deal with patient supports. And an unintended consequence could be that you have the nursing ratios that you would like, however, you have less nursing assistants, less patient care technicians, less other folks doing this other stuff, so you might only have 4 or 5 patients, but you're doing a lot more than you didn't do before in relation, because now these other positions are being either cut or they're given greater. So if it's not explicitly mentioned, that could be an unintended consequence of this.
Yeah, in our recent contract, we wanted to put in that about the ancillary staff, about the patient care technicians. We didn't want that to be touched, but because they're covered under another contract, we couldn't force that into the language of our grids and our ratios. But we understand that that may be, you know, collateral damage, basically, because we know they may reduce it. We're fighting for them not to reduce it. You know, we're keeping.
But the legislative language should have something on no backsliding on the ancillary support. So at least at the very minimum, that stays the status quo, it doesn't backslide.
Yeah, no, we agree,
Yes.
absolutely.
So we'll try to draft something to include and propose to be part of the resolution, some
Yeah,
type
it's
of
more
language,
important
some
than
type
the
of
message to
language,
the Albany
yeah.
resolution, you know, but I think that's something that needs to be mindful in terms of the language, because you may achieve one thing, but then be at a disadvantage with downsizing or layoffs in terms of the
Can we get a copy of that legislation? Get a copy of the
The
legislation?
legislation.
I have
think
one
we
copy,
know
but I would
If
be
you
more
can
We
than
can
send
email it, we
Send
can
it
email
around.
it to you. But Brian, what we could do is just, let's get like a toolkit of the legislation, the proposed resolution, the
That's
resolution that other boards have passed. That way we don't inundate people with so many emails and just send them one email with like 4 or 5 attachments.
Good. Thank you.
And I can email this to
Yes.
Wait.
Any other questions? So do we want to, we should discuss now, you all want to take it back to your committees, right? Have it go to the committees and then possibly if needed, have NISNA come to your committee to answer any questions and do a presentation there. And then, in October, I guess we can work on, what comes back from the committees and putting, making changes to a resolution that we could look at for October. But if it takes a little back and forth, we're looking at possibly, if, depending on how changes go, maybe November to get possibly December if we don't, get all the changes done on time and get to the vote. How does that work for your schedule? We get this to you before the end of the year?
That would be great, yes.
Okay, so then that gives us some flexibility in case, I know there's a process for putting things on your agenda for your committees, so that I can get to all the committees.
And we would be more than happy to attend the Health and Human Services or Health and Environment
Right.
committees and also the full board committees.
Thank you.
Thank you.
Okay,
Thank you.
great.
Thank you.
Thank you so much. Thank you.
Okay, we are moving to the Borough President's Report. As some of you may know, the Borough President has been the only Borough President to sue the mayor twice, and she was successful in the Two Bridges lawsuit. And so, there is talks going on in the community of putting a task force together so that we can get a ULURP matter that is more of what the community would want if and when this goes to ULURP. The stakeholders are coming together and there are discussions and that's a big victory throughout the city for this particular case, letting the mayor know you just can't, do this on your own and not go through ULURP and bypass the process. It's not transparent is what the judge said, so that's a big thing. At the end of July, we had the helicopter task force. Helicopters are just causing a lot of noise pollution. Among other things, there are some of the tragedies that occurred, including the recent one in CB5 where it crashed into the roof of one of these buildings. And so the problem here has always been that this is under the FAA and under federal legislation. Congressman Nadler's office has been very active, and so at this task force, we came up with a couple of things. One is this flight radar. There is an app where you can actually track it gives you all the information of what the flight number is, what the route is, and you can see these happening live. What we saw is a lot of helicopters just hanging around the Hudson River, so clearly they're like tourist helicopters. But very exciting during the presentation, April from our office, who was doing the demonstration, just pointed her phone outside and it captured a plane leaving from Newark. You couldn't see the plane, but it was on the radar and you got all the information. So that's kind of helpful for us. And moving forward, if there are certain companies that are engaging in certain activities or causing more problems, being able to track it and calling 311 with the number of the flight and the helicopter would help us to at least, be able to get some of those violations issued, if anything. The big thing is trying to get EDC, which the mayor can direct EDC not to have non-essential helicopters in Manhattan or in the city. The mayor actually did say this on the Brian Lara show, but has since backtracked. The city council has a resolution on this matter that was introduced by Councilmember Levine and Rosenthal and I think Chin, and it was introduced in June, right? So we're hoping that will get a hearing, and we can get and elicit more information and possibly push the mayor to actually go through on something he said. Imagine that, right? The other issue Gail and this office has been very active on is the illegal ticket hawkers at Battery Park. We've been working with the Staten Island Borough President's office as well. It's just harassment of anybody walking down the street. It's taking advantage of tourists. A lot of what they're doing now is taking people and not telling them, they're putting them on a bus and they take them to New Jersey and then get them on a ferry from New Jersey to go see the Statue of Liberty, sometimes not landing at the statue. And then when they arrive back at the pier in New Jersey, they don't bring them back to Manhattan, and these tourists are stranded, some of them who can't speak English, out in New Jersey. In the last couple of weeks, there's been a little bit more enforcement, so that's part of it. And the fact that some of these individuals who are hired by the companies have past criminal records, so they really are harassing people and scaring them and being just way too aggressive. CB4 is having a census forum today on jobs, and we've been working with the board on getting people there. I think about 80 people had RSVP'd. It's being done in conjunction with Google, and then there's another jobs forum coming up again after today's, and we will work with the community boards on doing this. I know some of the other boards have had some forums. I think CB8 is one that comes to mind. I can't recall which other boards have. Tomorrow, the 16th, today's the 15th, right, folks?
Mm-hmm.
Thank you for that. Tomorrow is the deadline for the expense funding known as MCAP here at the Borough President's office, as well as for the census grants. So tomorrow's the last day, and then we're hoping that we can, I don't know when we would make the actual announcements, and then get the funds out to individuals. There was a big meeting by Councilwoman Ayala on the violence that is going on in East Harlem. Earlier this year, the precinct commanders and actually the commissioner called for a meeting regarding all the gun violence and murders there. The borough president has been working on doing a follow-up to that meeting, but in the interim, because it's the summer and there's been more shootings, the councilwoman's office held a really big meeting where many stakeholders came to. The borough president is going to have her meeting in September, working with the councilwoman and everyone else, but trying to find a very holistic program, and she's been reaching out to people to put funding in place so that we can get the services there for the youth, so that they won't go into these acts of crimes and violence in the community. In Fulton houses, where there is a proposal to demolish certain buildings and then rebuild them by the city as part of the public housing stock that's there, we are talking about possibly doing a task force. There's concerns on both sides of individuals as how we move forward with this. And while the buildings are in bad condition, whether demolishing the buildings is actually the way to go about it. And for the East Side Coastal Resiliency, which took 2 borough boards to pass a resolution, but we did it, and we were hosted at the city council where we took the vote. We are talking about possibly doing a task force to deal with all the issues that are coming up there about the East Coastal Resiliency. Deputy Borough President Aldrin Bonilla, you want to talk about the paper challenge, the Manhattan Paper Challenge?
Everyone received the email about identifying groups within your district working on environmental justice issues, renewable energy, sustainable solutions to the environment, recycling, reduction of waste. So please populate that online form with organizations that you feel are moving the needle in this area, because soon we will be having the $75,000, maximum $48,000 to each community board district that wins the quarter to date largest increase in the percentage of tonnage of paper that's recycled. So we're very excited about that, and I'm very curious to see who's going to be the first 3 community boards to win in the first quarter. And it's a very exciting project because we're not only doing something good for the environment and for the closed loop economy around paper to box conversion, but also getting money into the hands of organizations that really work day in and day out with very little resources on these issues. Yes.
I just have a practical question for my own use. I recycle tons, and I spend a lot of time.
Hopefully not tons.
Well,
That's a lot of Amazon.
In my office, it would be tons, but I spend a lot of time taking staples out. Do I need to do that?
That's a good question. I don't even know what that.
No.
Who?
No, you don't.
No, you don't? It's 2 minutes, okay.
I don't know, I have to clean out cans.
Because,
Yeah, well, I do that too. I wash the aluminum foil, but just for paper.
So
I
I
just
have
think
a
that
couple of
was
questions
staples.
about the challenge. So
Mhm.
we asked to get some materials, and it turns out there are materials that are online. But if we're gonna have a meeting and if we're gonna get people energized, we need physical, I hate to have paper, but we will recycle, we will get paper and we will then recycle the paper.
yeah, but that's unfair because you're gonna ask for a lot of flyers.
But we don't need that much, but we'd like to have a meeting with, and our question is, we have several environmental groups that we've talked to that would like to be involved in the paper challenge, because we think it would be exciting for them, including a school. So for the 3 that we're recommending, are just, do they need to participate in the challenge, or are they just 3 groups that we think are?
No, you can recommend more than 3 groups. So, you may win the challenge more than 1 quarter. The promotional materials on the website, there's some flyers that you could download and print yourself. Our office is gonna have, some flyers developed that are specific to each community board, so that those could be distributed as well. But to the greatest extent possible, doing social media campaigns and just working directly with individual groups is probably the best, the best bet.
Right, but if we're gonna go to building managers and say they can learn about recycling.
Those forms, those flyers and materials are available for download off of the website. But we can work to get you. We can work to do some printing in house, or work with the Department of Sanitation to get some of that as well. Currently, right now, if you look at your the garbage trucks, the sanitation trucks, all of the Manhattan ones will have a flyer or a poster on the side of the truck announcing the Manhattan Paper Challenge. So I think you've already probably started seeing some of those, and if not, you're going to see those rolling out soon.
So, was it Grow NY that came to my building and they had little, plastic cans that you can put, recycled food waste in?
Mhm.
And then we have bigger garbage cans down in the basement that you take the waste from these little garbage cans and put them in the bigger cans, and the waste is recycled, and they came to the building and they had flyers and they had, a whole demonstration. And I know that, sanitation is willing to do that with some of the bigger buildings, like I'm in a big complex. So we could really increase recycling.
All right, so just keep populating those forms with organizations. In the event that your community board wins, then between the Solid Waste Advisory Board, which we appoint to, the community board in our office, we could decide which organizations in each district that have won will get the monetary awards. All right.
2 more things, and then we'll move on to the council members' report. A couple of weeks ago, there was a partial crane collapse by Lillian-Walled Houses and the FDR. It turns out that the company put more weight than they were allowed under law. And this is the same company that led to a fatality of a worker over on Bleecker Street. So now
What company?
I don't remember the name of it off the top of my head, but I can get it to you later. On Monday, DOB sent a press release, and I can send that to you as well.
Daily News had an article.
Yeah, DOB has stopped all of their permits throughout the entire city, and is requesting certain information and doing more investigation into some of the other sites that they were at. They didn't have the proper personnel there to ensure that the proper weight was being used, and to ensure for safety if anything fell that people were not around. So they didn't have all the required safety people in place and supervisors in place, among other things. So what happened at the FDR could have been a far worse tragedy than it was. And what it displayed to us was the lack of coordination. The individuals and residents of the buildings, many of them seniors, were not communicated to in their language, and many were outside sitting, waiting to get back into their buildings. And at midnight they were finally, some of them were placed in certain place, temporary relocated. And then when you vacate the building, the vacate order was finally lifted at about 4 or 5 a.m. But it just created just havoc because the coordination and the communication was not where it should be. And we are looking to, with the other elected officials who represent that area, have a follow-up meeting because, that should not be a problem. So if you can't communicate to the people who live in the building what's happening, then there are bigger issues, and we need to resolve them so that doesn't happen to residents in the future if there's ever another accident. Yes, Richard?
So what is the penalty for a company that engages in this kind of unsafe practice?
Well, there is a...
And not only once, but twice, and is it not the company or the individuals who are responsible? So what does the law
I can't answer all of that. I know for this particular instance on the FDR Drive, they were fined $110,000, which to me isn't enough. And the one on Bleecker Street is still under investigation, and they haven't made a final determination there, so who knows what kind of monetary violations there will be. There is clearly the consequence of suspending all their licenses and all their permits throughout the city has a big financial consequence to them. But the rest of your questions I can't answer.
Okay.
Anyone else? And then the last thing I'm gonna say is Harlem Month, actually known to everyone as Harlem Week, but it's really Harlem Month, is ongoing, and the borough president is going to be at a few of the events and speaking at one of the events later today. So go enjoy Harlem if you can. Councilmember Kalos.
Thank you, Rosie. Running a great meeting. On the issue of the helicopters, so many helicopters fly over my house every night that one of my daughter's first words is now opter. She hasn't gotten the helipart down, but so I was happy to be at the meeting with all of you, and I think I have some federal ways we can look at this problem and some other ways, so we're working closely with Congressmember Nadler and our borough president on some strategies that are binding that we can get something done here and get immediate relief for CV6 and CV7 and everyone who's and CV1 who are dealing with these helicopters. I also want to thank the borough president's office for hosting a scoping session in July on the super talls, and I want to thank everyone who came out. We filled the room and we got some very good coverage around it. On the issue of public safety, we've been doing a little bit more on that. 1 in 5 homicides in New York City is related to domestic violence. And as the mayor continues to run around saying that the city is safer than ever, not so for domestic violence related crimes, and rape is actually increasing. And so we need to do more, so we have legislation that will force the city to report on how they are engaging, and also with orders of protections. If anyone's been a victim of, survivor of domestic violence, they know that the orders of protections are sometimes absolutely useless. So just making sure that we are paying attention. We have a bike safety program on the Upper East Side that's in CB8 and in CB6. Year after year, we see it's safer for pedestrians. That program's now being rolled out citywide. If you have any interest in seeing it brought to your district and seeing some of the tools that we are using, we're happy to share them. We're also, as chair of the Committee on Contracts, we're looking at making sure nonprofits aren't self-dealing, but that they're also getting paid on time. So if you know any nonprofits that aren't getting paid on time, please ask them to email contracts@benkalos.com, and we'll make sure that they get paid. As you may have heard me mention once or twice or a million times, I'd like to get big money out of politics, in particular from real estate developers who are on the other side of our super tall fight. And we did that in June. And I really am grateful to Corey Johnson for that work. But Albany is still a cesspool of corruption, and they have a panel that is supposed to report out in December. So I recommend that if you care about campaign finance, and just to put it plainly, everything we do in New York City can be overruled by the state. Right now, there's a residential FAR cap of 10, 12 with affordable housing in New York City. Do you know what Albany would like to do? One of my board chairs is aware, they want to do an unlimited height. So just if you think of what people can do with 30 FAR in New York City, imagine 50 or 100, it scares me, and that's why we need to get money out of everywhere. Another key piece is we passed another set of questions for the charter, and so I was going to call a couple of my board chairs, but I'll mention it here anyway. We'd love to come, and I think it would be great to do informational meetings. You can only do informational. I am willing to come in an informational role or in an as a person who has actually taken a position on almost every single item in the on the ballot. But I think it would be great to do them all over Manhattan, and so I'm interested in partnering with you and the Charter Revision Commission. I also want to thank a lot of the members of Board 8. There was a piece in the New York Times. They've been putting very pro-real estate articles out that have been irritating a lot of you here, but they've also put out a pro-community piece. And I know that several members of my community board spoke, and I want to thank them. I also want to thank a local business that refused a $34 million buyout offer. It's called Shaler and Weber, and I'm curious if there's something we can do to honor businesses that refuse to sell out. We're also looking at the third-party transfer program. We had a hearing in July. I got a commitment from the administration that they would work with HDFCs and others to forgive some of their tax debt. And I think last but not least, there's 4 buildings in Manhattan that have affordable housing, whose deadlines are the 20th through the September 6th. You can subscribe at benkalos.com, and there's a lot more I didn't report on. It's just been slow, so sorry, we'll do better next month. Thank you.
Okay,
Thank you.
Councilmember Levine.
Thank you. I have to go in a moment, so I'm just going to offer one update on a battle that we're waging right now in the Health Committee against the epidemic of teen vaping, which is now estimated at 30% of high schoolers and middle schoolers. In our hearing on this, we had young people as young as 11 years old testify about the ubiquity of vaping in school. There are middle schools in New York City where kids don't go to the bathroom anymore because of the amount of vaping going on there. This is being fueled by flavors. There are vaping products in the city for sale with flavors like bubblegum and cotton candy and Fruit Loops, watermelon twist, chocolate mint, and on and on. Yes, it sounds very good, Jeff. It does. I didn't bring free samples. They're obviously designed to appeal to kids, and it's working. The The biggest player in this space is Juul, which spent years marketing these through social media posts that pictured young people in kind of sexy environments, making it look cool. They really marketed it as a lifestyle, and now we have a generation of young people who's hooked. And so we have a bill, Intro 1368, to ban the sale of flavors, flavored e-cigarettes here in New York City, with the exception of tobacco flavor. And we do understand that there are adults who want to quit smoking, who are using e-cigarettes as a way to transition off, including it. He's been very public about it, our wonderful council speaker who uses tobacco flavor. So there's an example of the benefits that adults can get. But we don't want kids falling into this addiction. Nicotine is an incredibly addictive product. The vaping industry is now pushing back really hard. They've hired most of the lobbyists in town. We are up to about 23 co-signers on the bill, and the advocates are only ramping up. We have a demonstration planned in front of Juul's offices next week, Tuesday at 10, their offices in Soho. And we're going to be pushing very, very hard into the fall to get this bill passed, to rein in this epidemic for young people. A few community boards have now begun passing resolutions on this. I think CB1 has passed theirs. Am I right? At least I know it was in committee. But it would be wonderful to have a show of support from other community boards. I think this does resonate with people. Probably everyone who knows a young person is familiar with this. And so it hasn't been hard to build support. We just need to get the word out in the face of very, very strong pushback by the industry. Yes.
I understand there was going to be legislation limiting the number of licenses to sell those vaping products when stores were popping up with the frequency of rain. And I don't know whatever happened to that.
Those are already limited, but we have 70 plus vaping shops in New York City. The bigger problem is the hundreds, maybe thousands of other places where you can buy these bodegas and other places.
And I thought they weren't going to be able to sell them, that there was...
Well, there are several state bills that didn't pass in the last session, including a ban on flavors. The only thing that did pass was raising the age to 21, but we already did that in New York City.
Is
So
that because of the advocacy from the...
Who knows?
you can draw your own conclusions.
Call it out, it's a cesspool in Albany and we need campaign finance up there.
It didn't pass. They had a lot on their plate in June. And it may, but we're not gonna wait.
Yes.
And we don't have to wait. We could pass this in the fall, and we plan on it. All right. Thank you all very much.
Thank
Sorry
you.
I have to run. Okay.
Okay, CB 12. Moving on to a community board report, CB 12.
Yes, although again, we in recess, we had a very busy August. So let me just highlight a few things. We had our national night outs for the 33 and 34 precinct, which was a very good turnout, both in Ann Loftus Playground and in High Bridge. We've had some developments with the MTA. They upped their schedule for the elevator closures at 181st Street Station and 190th. And in June, we had passed a resolution that we wanted shuttle buses. They were not going to provide us shuttle buses, and so everybody thought I was crazy to even demand that and insist upon unifying our community to ask for shuttle buses, because in that location, it is a 132-foot cliff. There is no access for the seniors that live below that level. And so with the help of the electeds, we organized a public information session and a march with the seniors, some of them who were 85, 95 years old, and the weather was extremely hot, 95 degrees that day. The MTA got the message, and we got the shuttle buses, And so I'm very happy at least that that campaign worked, and there was a unification of all of the people involved, including the Borough President's office, and we're very grateful that, and a letter was sent out. Subsequent to that, we had an MTA tour, which was organized with Udonis Rodriguez and Andy Byford on Wednesday and Thursday, where we went with the ADA community through a variety of stations throughout the 5 boroughs. We discussed the possibilities of putting more ADA compliant stations. He indicated that he had a consultant that is looking at all of the stations now to make them ADA compliant. We have a plan which we will introduce early next week for the current construction at 168th Street to make that fully ADA compliant as well, and we will present that to him. Finally, there was a decision on La Marina. La Marina, as you probably know, was closed, and it is a concession, a restaurant concession in a beach area with the Parks Department. It has now been broken down to only a restaurant. The marina area is separate, and the agreement was held in a bankruptcy court for an assignment of the lease, which required the agreement of the bankruptcy judge. The terms are very lengthy. It answered some questions, but not every question. And we will be discussing more of that in September when we're back in session. That concludes my report.
Great, CB 11.
Hello, everyone. So at CB11, we're currently not in session, but a few things have been happening. As you know, CB11 has had a myriad of festivals, just like all of us do, so we've had that. RAD is a particular concern in terms of housing in our community board. That's come up a lot in terms of different groups that have trepidation regarding RAD. So our councilwoman Diana Ayala took myself, my vice chair, and the chair of housing to go see a development in East Harlem on 111th Street that will be undergoing a RAD conversion. And in addition, took us to the Tanzas houses in the Bronx so that we could see their process. And overall, with the people that we talked to at the Matanzas houses, it was very positive. They were actually very good repairs that they've waited for a very long time. And it seems these are the same people that did the, I think it's Ocean Bay in Long Island, I believe it was, in Queens. And so, in Queens. And so they were there, they took their time with us and they showed us around. So we are putting together a housing forum that has been in the works for several months, and we're gonna make that the focus of RAD, pros and cons of RAD, to get more information out to everyone, because there's a lot of misinformation out there. RAD can be good depending on the funding and what you're doing for certain things, and what's hacked. For others, it may not be, so we just think that it's important to get the word out.
There, just I want to add, while you're there is 2 tours coming up of Ocean Bay. I think one is early next week, I can't remember the days. What we can do is, we'll call the offices and let you know when those days are, in case you or the DM or, one of the chairs of the housing committee, someone wants to go, then we can help get you, give you the information you can get there.
Thanks, Rosie.
Okay.
And then 2 sites in East Harlem were identified for potential redevelopment for affordable housing. One was the East Harlem Multi-Service Center and then YPD lot. The RFP has just been released. There will be walkthroughs at the Multi-Service Center in September, and all RFPs will be expected to be entered into, submitted by the end of November. We're gonna be looking at, when we get back in session, the e-bikes. We're seeing a lot of bikes on our sidewalks, a lot of bikes everywhere, that are actually in the street, that are actually causing concern. So we're gonna be looking at that. East Harlem has a pilot diversion center on 116th Street that will be having a September job fair. They're going to have 25 beds, and they're looking to open in December. And so as Rosie mentioned, Councilwoman Diana Ayala had a meeting because there's very great concerns on 125th Street all that, the host of problems that brings from the shelter, dropping people off there on the bus, people lingering, the different programs. So we're gonna keep an eye out because this sensor will be on 116th Street. And so we wanna make sure that, nothing, 116 has its own issues on Lexington Avenue, but we wanna make sure that this does not, further attract more problems, within that area. And, I'll leave it at that.
Okay,
No, we don't. But you will.
CB10? CB10 going once, twice, CB9.
So we met, our executive committee met in August to begin some planning for the new year. And one of the issues that has come up repeatedly in our district is new methadone clinics opening. And in fact, there's one proposed clinic that would replace a current outpatient Suboxone-based and Vivitrol-based center. So these are, from our point of view, preferable treatment methods that are prescribed by a doctor, filled at a pharmacy, and taken at home, or a longer-term injection, as opposed to the daily methadone where you have to come to the clinic every day, and it's like almost like a parole or criminal justice type center. And so we are fighting that because we would like to see more outpatient Suboxone. We think it involves like more inherent dignity for the patients receiving treatment for the addiction, and creates less ancillary problems in terms of attracting people who may be looking to deal with people struggling with addiction. So we're also taking a look at whether or not there can be an argument made about fair share here. This is not a use of land for, an undesirable local land use, but there are questions about whether or not the city's recommendation as to whether or not to allow a site to open should take into account the principles outlined by the City Council regarding the charter's fair use standards. So that's something that we are paying very close attention to and are dealing with on a number of fronts. Our Transportation and Uniform Services Committee will be proactively looking at the bus routes going through our area in advance of the MTA's 2020 Manhattan bus redesign. We want to come to them before they come to us. We're already being impacted by the proposed Bronx bus redesign, which has several lines that actually run through Manhattan Board 9. We are still working to get the Department of City Planning to commit to a rezoning for Morningside Heights. That battle has been going on for probably longer than I've been alive, but it's still one worth fighting, and we're committed to making that happen. And we're also facing a slew of upcoming very large tower developments in Morningside Heights that are taking advantage of the unrezoned area. We have a 35-story luxury condo building slated to open on 22nd Street next to Jewish Theological Seminary, a 40-story tower being built at Union Theological Seminary, and Columbia just released plans for a 45-story tower to be built inside 125th and Broadway, where there's currently a McDonald's. So all of these are as of right. So that is something that we are struggling to work with. Union Theological Seminary entered into a kind of community benefit flight agreement where they provided funding for tenant stabilization and anti-displacement efforts in the area immediately surrounding their development, which we were happy-ish about, but we're still both fighting those developments and fighting for some sort of ameliorating deal or benefits to be made to offset the impact they're having.
Okay. CB8.
I guess apropos of what Ben Kalis was saying, we wanted to do a town hall on city charter provisions last year. All of the community boards in Manhattan supported and endorsed, and so we're looking to work with anyone who would want to. We have a meeting about that next week to try and organize that. Lenox Hill Hospital is crazy about its proposed expansion. Its lobbying and PR efforts are full steam ahead. They want to double the height on Park Avenue that's allowed and triple it on Lexington, all for the public good, which leads me to wondering about not-for-profits and the arrogant way they insist they could get everything they want because they're a not-for-profit and it doesn't matter. So I would like to organize something with other community boards, I guess, on not-for-profits and the sale of air rights and all of these other things that they do and what they expect and what they want and whether that's reasonable or not. Not only do we have some in the administration who are not so enthusiastic about community boards, but we have the Landmarks Committee did not meet in August. There was an application to the Landmarks Preservation Commission. We asked them to hold off until, to lay it over until September. They said no. So we're concerned about now, and actually they had the hearing, but they had so many questions. First they said it wasn't controversial, so why does the community board need to be involved? And then it turns out that it is more controversial or raises more questions than they thought. So we actually will have an opportunity to weigh in, although we hope, although they did consider the hearing closed. We're still fighting, and I completely understand what you're talking about because we have no height limits on third, second, first, and north, and city planning has basically turned its back, but we are still trying to get 210 and trying to work with other community groups because there's nothing there, and they're putting up 40-story buildings every single day with huge impacts, and that was what that article in the paper was about. On the census, we've done a number of workshops where a lot of people from the community have come in, so if you need any, and if you want to just run anything by, we have an amazing woman who has just taken this on by herself and has had, she's just fantastic. We think it's so important. So that's it, and thank you.
Okay, CB7.
I know. So, because we're not supposed to meet in July, in August, we get extra brownie points if we meet. So, last Saturday, the housing chairs of 5 different community boards met at CB7 office, so we get 5 boards get lots of brownie points. And we came up with a plan. We're very concerned about NYCHA. CB7 and I have been working together very closely for the last 3 years to, on behalf of NYCHA. So we have a draft letter that we're hoping that everyone could sign on to. We're asking Gail if she would host a meeting with Gregory Russ, who I think just started this past week. To meet with us, so we have over 100 locations of NYCHA buildings in Manhattan with over 55,000 residents. To have a meeting in, hopefully in October, of the city colleges or somewhere with a large auditorium, with a set of questions that we will submit to Gregory ahead of time, and just kind of find out what it is that he plans to do, and also give residents an opportunity to voice their fears and concerns. So that's the first thing. The second thing is we're working with, we've hired George James to work on, we have 2 large NYCHA developments that could be part of infill. We have one that's part of Brad, Wise Towers is now part of Brad. So we've hired George James with some of the extra money to look at where there could be or should be infill at these 2 different locations and how it might affect us. We're applying for a grant for a urban fellow who can look at the data of seniors and youth in both locations. We're partnering with Goddard Riverside. Our first vice chair actually is in charge of the Children's AIDS program at Frederick Douglass House, so she's offered to use her office space for them to work at Frederick Douglass, and Goddard will be at Amsterdam houses. Goddard Riverside has offered to partner with us on this, and Landmarks West has partnered with us because they've already done studies on buildings as preservation. So that's very exciting. We're doing a forum on the new rent laws we're doing an emergency preparedness, we're co-sponsoring with, Senator Serrano. And we're meeting on Monday to set up a complete count committee on the census. That's it.
Okay, CB6?
Okay, hi, everybody. So the RAD, I wanted to mention, Melissa left, but if anyone else is looking at that, so we have two night shift properties. One is they're very close to each other on 28th. The 344 East 28th is being, moving forward the conversion to RAD. And they did do that tour. It was actually on New York 1, so there were some folks on TV that had gone to the Ocean side?
Ocean Bay.
Ocean Bay tour, so they were very happy with what is moving forward. And we have some nonprofit legal aid to them. We've really been on top of it. Carlina, our city council member, Rivera, and CB6 office have really been making sure that all the tenants there have the tools they need. So if anyone wants to talk to us about RAD, I feel like we really got the upfront kind of experience of it all. And then thank you for the NYCHA letter. I think that would be really important. We're on board for that. So
And you have directed we can get extra credit.
okay, good. Thank you. I saw that someone showed up. So we also have Mount Sinai Beth Israel with 15 properties in our area that they're moving to the Lower East Side, and we are trying to work, if anyone can help us with this or knows any groups we should meet with. We're meeting with Supportive Housing Network of New York this afternoon. Our housing folks are meeting with them. But we're looking to, talk to Mount Sinai Beth Israel about some of these properties, not all of them. Some of them are residential zone, commercial, some of them are commercial zone, but 15 properties, right? They're saying they're not sold yet. They don't know what's happening. Some of them have already been sold. A few have already been sold. But so community planning, we like affordable housing, we like supportive housing. We have really successful supportive housing of 28 homeless people from Muzzy, Rosenblatt at BRC that's in our area, right in that area. It's really done well, and everyone's very happy about that. So if you have any, nonprofits or people we should be meeting with, we're looking for all sorts of guidance and, just to make sure Mount Sinai Beth Israel at least works with the community as they sell these properties. So, the helicopter task force, we have 34th Street Heliport, and it's kind of, they don't give back a lot. It's EDC leased land. It's dangerous. We just put in a new bike path right next to it, and it's just, the pedestrians and bikes are all smashed in. This giant heliport is just in our district, and we'd like to see it reduced to essential flights only. So we're meeting, so we're really on top of that task force, so thank you for doing that. The flights have increased, we've had a lot more complaints. It's just been that our whole waterfront is mostly EDC leased land. We have a water club that's closed to the public, so just open for private events, only a giant parking lot. We have a lot of these kind of neglected waterfront areas between 23rd and 53rd. So we're really trying to work with the city and EDC and, to get fight these pieces of property, get them back to the public. So we love the whole thing.
Yeah, and just CB6 is, as per Better NYC, got us the data, the community board with the most helicopter complaints, and 2 of the top 3 zip codes are in CB6.
And that's spiked, like in the last 6 months, and it's hovering. So I don't know, I think maybe those Uber rides
The
come there?
Ubercopter just started in July, so that
I
we
don't think
didn't have enough
that's it.
data from that.
Yeah.
All I know is when I drive from Brooklyn visiting my parents and I think these helicopters are gonna crash, they're actually landing in the water.
Yes.
It's so unnerving. Yeah, there's more helicopters landing in water and then making their way to the pier.
We would love to see them, flights reduced, but have them, they have 2 giant pads there. The Ubers that come in and drop them off and pick them up it's just quite a mess. So we work with DOT and EDC. We're doing another walkthrough next week, but we're on it. It's just
Maybe we can join you on the walkthrough.
Yeah.
Okay. Oh, thank you. I'll make sure you have a date. Thank you.
Okay, CB5.
Okay, first I just want to say I'm not a smoker, I've never been a
smoker, but if they do truffle flavor or pizza.
Ooh, truffle, you know it. We have some real concerns about Mount Sinai closing, and our committee has been on the task force. Gail has a task force, I'm sure
We're
you're
on
reps on it too. Basically, what we're concerned about is the lack of information to a lot of the questions that we have. And we're told that there were 261 beds, that's including 95 behavioral health beds at Mount Sinai, Beth Israel. That's based on their own reporting. And all these beds are going to be gone. So the new smaller hospital is supposed to have 70 beds. So we're told that these beds replace the 70 beds that are currently available in the Ioneer Hospital. And when we ask questions on exactly what does that mean, we're not getting an answer. We have no idea. So our questions basically are, where do the 261 people go that are occupying beds right now in Beth Israel? They will move much of the behavioral health care downtown to Rivington House, right? Which again is reducing the beds available for this type of care, which we believe obliterates the possibility of nursing home beds in Rivington House site, I think. I think all of this is, from what I'm getting back from our representative on the task force, none of this is really clear. So our concern is who can answer these questions. Renee, our committee chair, and our vice chair will be meeting with Carlina's office, since Carlina's the chair of the Committee on Hospitals. And we're interested to learn if other community boards have the same concerns and questions, and maybe help figure out or find out what's going on. Especially since this is important in light of all the political focus on healthcare. So, Vicki, I would say that they say that the buildings in our area are under
Utilized.
Yeah, underused.
Yeah.
They're not full. The beds aren't full, and that's why
Yeah,
that's
just-
how they explain.
Right, going back to when I was in the city council, all those ages ago, right? They had talked, the 70 was reduction of just the hospital beds, which they had 400 and something beds, but they were only utilizing 100 and something. And at Ioneer, there are 70 beds there for surgeries, and they have maybe 1 or 2 occupied. So
So the
The
70 they're moving is moving into the unoccupied. Is that it?
so they're reducing. Currently, if you take what's at Ioneer and what you take what's at Beth Israel, would add up to maybe 200, maybe. And they're reducing that, so that's 200 out of 400 and I think 95 beds.
Yeah.
So it's less than 50% utilized. And they're going from that to 70 because on average, that is what's mostly utilized. Plus they're planning to go to your home and do other types of services where you don't need to be in a hospital.
That's their whole premise.
Right, that's their whole
Right.
premise. The behavioral beds was never part of that 495. And that, through the years when I was in office, they've come back and gone through the state and reduced those beds because, but not by a lot, it was like 25 here, 50 here, because there was less of a need for those beds. And so whatever that number is, and I don't know it off the top of my head, that's being transferred to Rivington House. And that seems to be more or less a bed per bed transfer. But yeah, we'll get an update from the people who are involved in the task force, and we can get you some more
The
answers.
other thing that the committee wanted me to note was that Mount Sinai has reported that they're closing because they're losing money, and the
the site is likely to realize over $1 billion, the sale. And what we're seeing, what the group has been investigating, is a trend that's happening now. They found that in Philadelphia, there's a hospital called Hahnemann Hospital that's closing due to losses, and the land will be allegedly sold for a profit. I mean, this is something that's becoming
Look at Cabrini.
yeah. And last but not least, on the final note on that issue, since 2000, New York has lost 20 hospitals.
Since when?
2000, since the year 2000.
Yeah.
That's crazy.
The next thing is, we've been conducting research on the need for public toilets, and plan to use this information as a basis to produce a two-page document that can be shared with all the bids, the community boards, and other stakeholders, to gauge interest and support. We'll outline the lack of toilets as well as the reason they are needed, including the cost for cleaning, public defecation, the public health implications of open toileting. We haven't yet completed the paper, but we have a lot of research that's been done so far. 3 points that came out of it thus far are that there is 1 public bathroom for every 7,700 people, for a city with a population of 8.6 million. This does not include the 62 million annual tourists that visit the city. There are only 2 public bathrooms open 24/7, and there have been 2,164 complaints to 311 about public urination. So we'd be happy to hear from other community boards on how interested you might be in trying to put forth some kind of real push for an increase in
Very interesting.
public toilets.
Thank you for doing that.
Our commercial waste proposal, we talked to you about that a couple of months ago. We're very concerned. We know that DOS put out a proposal. We've learned that the proposal was never offered as a bill, and now it's a single corridor bill, which was introduced by a council member. That means that there would be an RFP for 1 corridor to handle all the commercial waste within the district. So we're very alarmed by this, especially in City 5. We have I think more than any other, because we're a business, we have a real problem. So we attended a hearing on the bill, and members of the committee are going to meet with the electeds and have already met to voice our concerns. So one of our concerns is that we believe some form of new legislation will be adopted, and that many of the small businesses will have, will be affected and have no idea what's in the works, and we're not sure how they're even going to be informed. So we want to know what recourse they will have if prices go up, collections are not made. On budget, very quickly, we had 4 main issues: congestion, transportation, affordable housing, and public safety, like homelessness. And when you look at the city data on 311 complaints, our district has a large number of noise complaints, complaints of dirty conditions, complaints of homeless encampments. So we're trying to meet with agencies, bids, and other stakeholders, but we'd like to know if other boards also are experiencing specifically homeless encampments, because we're really seeing an increase, enormous increase, yeah. And lastly, it's funny, we don't meet in August, so I was trying to think of what would be of major interest to all of us, and I got 2 messages from Layla, my landmarks chair. And the first was that she said in the first time in history, she's pretty good on this, I think she's right, that landmarks LPC canceled their July meeting for lack of applications. And we have to cancel ours for lack of application. We've seen an incredible decrease in the number of applications that are coming to us, and in CD5, as you know, we have a huge number of landmarks and landmarks issues.
Is that because of the rules, the staff?
That's because the staff is approving.
Yes.
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 Exactly. And so, this was the first time in the history that they've ever canceled their own meeting. And so I said to her, it is. So I said, I'm gonna report this, we should And then yesterday I got a text, just yesterday afternoon, they canceled the August one.
Oh.
So anyway, that's the end of our report. My conclusion is that, you know, it's true what's happening now
We should do
with
a
the
letter.
staff. There's no transparency.
No,
None
and they're making big
whatsoever.
decisions
Yep.
too, bigger than they should
Yeah.
be.
So I don't know what we can do, but I think we all have to try to figure out some way to voice our, not just concern, but anger.
Could we do is it possible to do a borough board resolution about that? Asking to revisit those or asking to change or do something about it or voting on?
Yeah, I think so. We could certainly do a letter about this, but maybe we could put up a resolution and,
That'd be great.
I think it's something also to note is much like we see in residential developments and residential buildings, the applicant before DOB isn't often always honest with regards to whether or not there's occupied tenants, and so in this case, are they not ticking the box that it's a landmark?
Yeah.
And so DOB is processing that like any other application as opposed to seeing whether or not LPC had already opined. I've seen that in a professional capacity, and we also see that in other parts of Ward 4 as well.
That's really interesting. If you have any information about that, could you send that around because that's something.
It's all anecdotal and mostly
Yeah.
through just my understanding of historic districts, and
Right.
I see changes take place and I go, LPC never would have, allowed that to
If they
happen.
knew.
So,
Scary.
DOB issue permits for it.
right, but DOB doesn't first check if it's in a historic district or if it's a historic landmark building.
they're supposed to have something that triggers, because we complained about this in the council. And so at some point, they were issuing permits and it was in historic districts and it wasn't flagged, and there was a problem with their system that wasn't flagging that it's a landmark or a historic district. So maybe that's happening again, or, you know,
Wouldn't be terribly surprising.
right, exactly.
Unfortunately.
Okay, CB4.
Hi, everybody. Jeffrey LaFrancois. I'm the second vice chair of Community Board 4. Our chair and vice chair were able to make it today. Thank you, Vicki. It's great to be here. Just some brief updates to add to what Rosie said about NYCHA and also Board 7. Fulton Houses specifically is really being talked about. We've written a letter asking for the development of a task force specifically involving all the elected officials, all the stakeholders, so residents, the community board, to actually be at the table and discuss all of the possibilities that could be employed to address the needs of not just Fulton Houses, but the other developments in Ward 4, of which there's 3 total. And the idea of demolition, not being the first result, first proposal at all. So thank you to Gail for being a part of that, and we're looking forward to having that conversation. On the Port Authority, we are responding to the preliminary draft scope hearing as part of the EIS, so it's even before there's been a release of what will happen at the Port Authority. This has been a long time coming, and we're relieved because we first had said to build on site, and then Port Authority said, no, that's not possible, and then they came back and they said, we're gonna tear down more land in Hell's Kitchen like we did in the 60s, and we'll build it here, here, and here. And we, of course, said, no, that's not right. And then they came to their senses and they went, oh, I guess we can develop on top of the Port Authority that's there today. It is possible. So we're happy to be in this actual community sort of driven process right now, and looking forward to staying online with that. And then just a note on the census, we were really excited to be able to flyer and hold this forum. We specifically targeted the NYCHA developments in our district as a means to get these folks jobs, because some of these jobs are really well paid. And while they're temporary, it's a great opportunity for skills and just development of all that sort. So we're really happy to be a part of that. And just a note on helicopters as well. Come and have a drink with me at the Frying Pan, which is a barge in the Hudson River, just south of the 30th Street heliport, and you will see, I counted 22 helicopters in an hour that landed and took off from that, at least. So it is a major problem in 6, 4, and 1 in terms of where they can land, and then obviously where they're flying. Their flight paths is extremely complicated issue. It's very scary.
How is this, I can't even.
I see them going up the Hudson River, but I don't see them coming back down, which means they've turned into Manhattan.
They go over the park.
Mhm.
Thank you.
Okay, thank you.
The most
CB3.
interesting drinking game around.
How many drinks can you get down between now and?
Well, good morning, everyone, and I am so thankful to be here this morning because I am on vacation. What a way to spend my vacation. I have another meeting that I have to run to right after this. So I utilize all of my free time. So first things first, I'd like to thank everyone for the hard work, the borough president on the hard work for helping us to get a ULURP passed for 2 bridges. It is amazing, the work of the little man. The people in the community are ecstatic for this process. It is so needed because the 2 Bridges community is going to be overwhelmed if those 3 towers would be built to the height of whatever they want it to be built. And we know that the process is not over, but it's a start. And so we have a voice back. So that's amazing. We passed the resolution for the ESER preliminary design, and so the East River final design is coming soon. And so we're looking forward to more sleeves rolling up and getting ready for that process along with CB6. Just one last thing, and then I'm gonna be done with what I have to say, because I have to run. Best practices on how we work as a team amongst the community boards. It's just, it would be good if like we don't oversaturate ourselves and extend ourselves to do things as community boards, because what we've noticed is that people are coming to us for issues that are not happening in Community Board 3. And so they'll step up and they'll come to us and we're like, nope, that has nothing to do with us and we're not gonna overstep our boundaries. We have to be able to say that to any group that is coming before us that is now trying to say, well, we know that you're in this boundary with this community board and so you should take this on. No, we're not doing that because it's something that I've addressed to my executive team and then I'm gonna say, you know, to the members at large, please don't open up a door that should not be opened. We need to work as a team cohesively with our other community boards. And so if we're gonna form a task force, then let's form a task force. If we're gonna stay connected, let's stay connected, but don't overstep each other's boundaries in what the work that we're doing, because we all do a tremendous amount of work. And it doesn't mean that we all have to reinvent the wheel, as they say, right? Just working together better for better practices, that's all I'm saying. Thank you, everyone, have a great summer. I think me, Susan, and the office, and SLA are the only people working in the month of August. They never stop working, SLA, so thank you all, and I'll see you soon, hopefully. If not, you'll be seeing my second vice chair. We utilize everybody.
Okay, thank you. Okay, CB2, CB1.
All right, the last one. Like everyone else, we didn't have any meetings in August, but that doesn't stop all the issues. Some good news, in July we had an election, we have a new vice chair, Tammy Meltzer, who we may have met and probably will meet in the future. And we have a couple new openings, so our board is refreshing itself, which is wonderful. There was a lawsuit from one building here, from tenants about 421J. And the wonderful thing is that they won, and they will be owed back rent because the landlord financing based on rent stabilization. But we want to perhaps partner with others and run a forum, because we realize that there are lots of other buildings that now need to step up and say, hey, to the landlord, you know, we have to figure out what this means to us all. So you'll be hearing more, and we'll try and contact you about doing that. 2 major things. Howard Youth Corporation is coming to us and wants to, they've hired Skidmore, Owens Mellon to do a master plan for them about the whole Seaport district. And we've been asking that for years, so we'll have a community engagement about that in the very near future. And there's lots of impact on that, both on the new market building and on a property they bought on Water Street. And and that's gonna happen probably. We'll also have a Seaport advisory group at the end of this month here. We're also working both with DOT, our local bid, and one of the major neighbors community groups down here about implementing a traffic study for Lower Manhattan. I mean, we all are experiencing issues with traffic, and no one's come up with a plan to say, here's how you manage it. Congestion pricing may or may not really address it, and so that's a major activity we're going through. Yeah. At least for our district, but obviously it will spill over to. Right. And at least it's 4 ideas of how we can start to manage through it. I mean, sometimes DOT comes up and says, well, let's approach this particular street. Sounds wonderful, but it pushes traffic all over the district and maybe creates more of a problem. So a more holistic approach, as we say. Finally, the whole issue is helicopters. I can't believe it. If you're what's called a respected user of Uber, it's a 9-minute helicopter ride from the downtown heliport to JFK for $200. You can't do that for a limousine and get there in the same day practically. So the uptick, I mean, they are just hovering over Wall Street heliport. There's 5 pads there. There's a helicopter on each one and 4 or 5 hovering above it. So it's just when you think it was bad, it's getting worse. And there's no control over it. And they're not essential, they're not tourists, it's a commercial venture. So, that's it, thank you all.
Okay. Councilmember reps, before we end the meeting, Councilmember reps, Edonis, right? You want to give a report for Edonis's office?
What's that?
A report for Edonis's office?
We currently don't have one at the moment.
Okay.
Thank you.
Anyone else? Other people left? Okay. So this meeting is adjourned and we'll see you next month. We'll get out all this information. Actually, if you didn't get one, I still have business cards here for the nurses. Okay?
And you're gonna send out all their material?
Yes.
Yeah, we're gonna send out all the material.
We'll send them